Survival skills. Learning about survival skills. Fainting or losing consciousness. Fainting is a brief loss of consciousness and is the result of an interference with the function of the brain. There are many causes of unconsciousness, the most common of which are fainting, head injury, epilepsy, stroke, poisoning, diabetes, and conditions associated with the lack of oxygen. If you have seen a person fainting, then do's: catch the person before he or she falls, pinch the person and see if she moves or opens her eyes. Examine the injuries and causes of unconsciousness. Tilt head back and keep arms at right angle to body. Raise the legs 8 to 12 inches. This promotes blood flow to the brain. Loosen any tight clothing. Keep the victim warm if it is cold outside. Keep a record of the casualty's condition. Don'ts. Don't give the patient anything to eat or drink. Don't allow the person who has just fainted to get up. If the area is warm, don't crowd around the victim until the victim is fully conscious. Burns. A burn is damage to the skin caused by contact with the dry heat. It may be caused by fire, flames, steam, hot liquids, hot metal, sunlight, electricity, or chemicals. The degree of burns varies. First degree, superficial, involves only top layers of the skin and is red and dry, and the burn is generally painful. The area may swell. Most burns are first degree burns. Second degree, partial, thickness, involves both the epidermis and dermis. The area is red and blisters may open and weep fluid, making the skin appear wet. These types of burns are usually painful and the area often swells. Third degree, full thickness, destroys both the layers of the skin with muscles, bones, blood vessels, and nerves. These burns may look brown or charred with tissues underneath, sometimes appearing white. Do's: immediately immerse the burn area in cool water or by applying clothes soaked in cool water. Remove jewelry and constrictive clothing before swelling or blister occurs. Cover the area with a dry, sterile dressing and not cotton or other fluffy material. Drop, cover, and roll if caught fire, or cover the person with a blanket immediately. Don'ts: don't place a burn under extreme water pressure. Don't remove the cloth that is stuck to the burnt area. Don't apply butter ointment, oil, ice in the area affected. Frostbite. Frostbite occurs when body tissues freeze after exposure to below zero temperatures. The signs and symptoms include white, waxy-looking skin that is firm to the touch, but the tissue underneath feels soft and pain followed by numbness. Do's: cover frostbitten toes, ears with warm hands. The area affected can be warmed by breathing on them or placing them in a warm area of the body, or by dipping the affected area in warm water. 40 degrees centigrade. Cover the area affected. Don'ts: do not rub, as tiny ice crystals in the tissues may cause more damage. Never rub snow on the area, as this may cause further freezing, and do not apply direct heat, as this may re-warm the area too quickly. Do not let the patient walk. Do not break blisters if any. Bleeding. Cuts, scrapes, and punctures can result in bleeding. Severe bleeding can be life-threatening. To stop bleeding, restore to direct pressure, elevation. Lie victim down and raise the injured part above the heart and handle gently if you suspect a fracture. The blood gets thicker after bleeding for a few minutes. This is called clotting. Clotting slows down bleeding. Bandaging is done to stop bleeding and to stop dirt infecting the wound. Change the bandage at least once a day and tetanus injection needs to be taken if required. Snake bite. Most of the snakes are harmless. It is because of our fear that snakes generally attack us. Snake bites generally occur on the limbs and most often on the legs. Always assume the bite to be from a venomous snake. Suspected snake bite must be treated with a pressure immobilization bandage. Do's. Keep the bitten limb below the level of the heart. Allow the affected area to be bleed freely for 15 to 30 seconds. If the bite is on the limb, apply a firm roller bandage 2 inches away from the wound. Wash the affected area with the soap and disinfect the area. The bandage should be loose enough for a finger to slip through. Constantly check airway, breathing and blood circulation. Start resuction if needed, but see to it that there are no wounds in the mouth. Suck it out but do not swallow. Spit the venom out. Rinse your mouth afterwards. Shift the patient immediately to the hospital and see to it that the person is at rest during transport. Stay calm. Instruct the person to avoid all movement on the area affected. That is all in this lesson. It was very interesting to learn about the precautions and measures that has to be taken at the time of different calamities and situations. Always be ready with your first aid kit.